Hi, this is Dr. Mitch Chasen, Medical Director of Reflections, and today we're going to answer some questions about fibroblast, or some people call it the plasma pen. Why are we seeing the kinds of complications that we are with this device? Well, the device is delivering energy to the surface of the skin. It's actually causing a burn in the very top surface of the skin. And that is supposed to bring about improvement in skin quality and tightening. Well, we're not seeing those results, number one, and number two, we're seeing complications because this is essentially creating a burn. And a lot of people will heal from a burn with either excess pigmentation, with less pigmentation, so in other words, they may get dark spots during the healing phase or light spots, and they may even get a scar. And we've seen complications each and every week from this device. So it's being touted as the answer to crepey skin and loose skin on the lower face, on the mid face, and even in the upper face around the eyelids. And patients are noticing very often that they're having pigmentation that persists way after that treatment, and things that we have to use topical agents and other technologies to reverse. They're also noticing scarring, because essentially this device is creating a burn in the surface of the skin. Most technologies today in aesthetics are delivering energy deep below the skin's surface and bringing about improvement from the inside out. So the days of traumatizing the surface of the skin, like we used to do 20, 30 years ago, are gone. So why is this device here now? Number one, this is not an FDA cleared device. This is a device that was used overseas, then it was used in Canada, and slowly came into the US. Unfortunately, it's not a device that has been evaluated by the FDA. It has not been cleared or approved by the FDA. And in other countries, it's a product that has been banned because of complications. Canada itself, within the past year, has banned the use of these devices. Devices today in aesthetics have safety mechanisms built in. They can monitor the energy that's being delivered. They can measure the temperature in the tissues. They can monitor the skin's reaction to the energy we deliver. With this plasma pen, there is none of that. And essentially, it's just creating a burn in the surface of the skin, and it's relying on that skin to heal from that burn. Unfortunately, a lot of patients don't heal well from these surface burns. They heal with pigmentation issues, could either be dark spots or light spots, or they may even heal with scars. And each and every week, we're seeing complications from the device. These devices are not in the hands of physicians at this time. They're in the hands of non-medical personnel that are offering this device as the cure for looseness in skin, for crepiness around the eyes, to lift the brows, for many different things that it's just not going to do on the basis of how it's delivering energy. And we're even now seeing these devices sold literally on Amazon, on eBay, and patients are doing these things at home. So the FDA is there to evaluate these products, these devices, to make sure not only that they work, but that they're safe. So in the future, these devices will hopefully be evaluated by the FDA. They'll take a look at what the device is doing. They'll probably add safety mechanisms to prevent complications. And really important, they'll evaluate whether it's actually doing something and see if the results are there as being promised.